My name is Joanne King, and for those of you who might not have met me before, I'm the co-chair of the steering committee for the Ottawa Valley Ontario Health Team. I also work for Barry's Bay Area Senior Citizens Home Support Services, serving frail older adults in the far western part of our area, in and around Barry's Bay, Killaloe, etc. So I'd like to start by saying welcome, everyone, and thank you for joining us today. We are really and truly thrilled to introduce our new collaborative partners mini-series. It's a series, as James said, of 45-minute online sessions designed to offer a deeper dive into our latest initiatives at the OVOHT without requiring that significant time commitment for our busy partners and participants. So this first session is dedicated to the Ottawa Valley Health Connect online navigation and referral site. And as we all know, the world of healthcare services can be very complex and overwhelming, especially for seniors and caregivers, especially when you're in an acute crisis situation. It's hard to take information in and find what you need. Recognizing this challenge, Ottawa Valley Health Connect has been crafted to simplify and streamline the pathway to vital community care services. We really appreciate your attendance in this inaugural session. Our mini-series format will focus on the essential details and outcomes to try to facilitate a deeper and more comprehensive understanding in both efficient and hopefully engaging way. So thank you for being here. I do want to take a moment to express an acknowledgement for the land upon which we work, live, and play. The Ottawa Valley Ontario Health Team acknowledges the land on which we operate has been inhabited by Indigenous peoples from the beginning. As settlers, we are grateful for the opportunity to work here, and we thank all of the generations of people who have taken care of this land for thousands of years, for millennia, in fact. We acknowledge this is the traditional and unceded territory of the Algonquin Anishinaabe. We recognize and deeply appreciate their historic connection to the land. We also recognize the contributions that Métis, Inuit, and other Indigenous peoples have made, both in shaping and strengthening this community, as well as our province and country. As settlers, this recognition of the contributions and historical significance of Indigenous peoples must also be clearly and overtly connected to our collective commitment to make the promise and challenge of truth and reconciliation real in our communities, and to bring justice to missing and murdered Indigenous women and girls across our country. Miigwech. So now I'll introduce our three presenters today. We have Sarah Utronki, who's the Director of Patient Services of Home and Community Care Support Services Champlain, and who's also a member of our navigation table. We also have Samantha Kelly, who's a member of our patient family and caregiver network. And Samantha, and is it okay to call you Sam? Samantha lives in Horton. We also have Hans Colburn. Hans is our communication and engagement lead and supporting us in always communication. So I'm going to turn this over to Sarah to start us off. Thank you all for listening.
Thanks, Joanne. I'm really excited to be here today and be able to help speak to this. I think that having something that is local to the Ottawa Valley OHT is exciting, and so thank you for including me in this to the OHT. So the Ottawa Valley Health Connect website was developed in response to the needs expressed by local home and community care services. And many of us here at the call are part of that network. And so there was a call to seek a local, efficient way for seniors and caregivers to find necessary care. The initiative was aimed to create a streamlined, accessible platform to ensure that those in need of support could easily navigate and connect with the appropriate services, enhancing the overall experience and accessibility of the care for our elderly and their caregivers in our communities. So our approach with the Ottawa Valley Health Connect is not just about creating another digital tool. It's more than that. It's about fundamentally transforming how patients, caregivers, and providers interact within the healthcare system. So by prioritizing navigation and access, we're setting a new standard for healthcare delivery in our community. And it serves as a cornerstone in our mission to enhance healthcare access, coordination, and patient transitions in line with provincial goals. So to set some context, the OHTs are mandated to improve access, transitions, and coordination by designing and implementing coordination and navigation services. So an actual tangible item. This is a deliverable, was given a January 1st deadline, but also it was a specific request made by some of the partners within the OHT. There has been great use of CareDove across organizations. Many of us are involved already in CareDove, and you can see some of that success reflected in the numbers presented before you. But we wanted to expand these benefits to clients and caregivers as well. The big difference between any past navigation options and this Ottawa Valley Health Connect is that it is a standalone. So while connected to our OHT, the service is not subject to any OHT change in structure. It can last beyond whatever happens next in the navigation world. So it's also easier to communicate as you know, this fuzziness of what's happening in the OHTs doesn't get in the way of using this resource. And it also doesn't confuse the fact that the OHTs are not the service providers providing these services. So while the former app service at the OHT website had navigation as a feature, Ottawa Valley Health Connect has it as its focus. So that's the really big difference and why it's so exciting. So that's all my role today, and now I'll pass it over to Hans to give you a high-level look of how it works.
Awesome. Thank you so much, Sarah. Yes, indeed. In the world of CareDove, as many of you know, that navigating the healthcare landscape, you know, becomes a story of connection and hopefully of ease. And you know, in the best state, booking is a breeze, and it leads to a swift link up with providers. So while it is a standalone page, you'll see a couple of screen grabs from Ottawa Valley Health Connect. It is its own page, but Ottawa Valley Health Connect is still connected to our OHT website. If you click on Connect to Services on our OHT website, it brings you to this specific homepage of Ottawa Valley Health Connect. And you can also see that the branding also includes our Ottawa Valley Ontario Health Team logo and our new Ottawa Valley Health Connect logo as well. So we worked with our CareDove partners to use buttons, to use tiles, to use some different links, which all funnel the users to one specific part of the page to ensure consistent user experience. And you'll see that part in just a minute. But to explain who it's for, it is for service providers who want to capture some high quality referrals and streamline that intake process and obviously connect their clients to care. It's for referring sources to connect their clients with care, and of course for caregivers and clients who can now go in and find the care that they're looking for and make that connection. So talking about that funneled page, this is what you'll also find on our homepage if you scroll down just a little bit, but all of those buttons will also take you directly to this. This is the portal, if you will, and I'm sure many of you are familiar with this with this layout for a portal from CareDove. It really is just a simple form, and it asks for your address. You can see the address bar right there. That's to specifically locate a service. So CareDove will search for services close to home, the address that you provided, marked on the map with a home icon. And as services are found and identified, they'll be marked on the map and then listed on the left-hand side over here. So again, that's where you put in the address where you want to find the services that are closest to. So let's talk about booking local services. From here, the flow is fairly intuitive, and if I can say that, then I think it is, because I've used it just in a test scenario, and it was really user friendly. So once typing in your full address, you select the type of service that you may be looking for, and you hit search, and that will populate the most relevant search results. Then you select request service right here on the service to make an e-referral. Now, if the agency has some appointment time slots, then you'll see them on another pop-up, and you'll see that they're listed here. So those are the times that you would be able to select from. Choosing one of those time slots then brings up the appointment selected box, and that tells you this is the appointment that you've chosen and the time. Then you hit continue. Now, if there are no appointment times to book, you will see see this button here instead that says request without booking, and that will be the one that would be highlighted. So either path brings you to the booking wizard, which they call it. It's going to continue to ask a few questions, including the types of care requested, contact information, etc. Now, you navigate through the wizard until you can select finish. And this will automatically send an email to the appointment provider and the registrant, if that person has included their email and all the contact information, indicating that a referral has been submitted. So both the organization knows, and the person who referred has a confirmation email that says that that referral has gone through. And again, if it was booked into a particular date and time, that information is going to be included in that email. Interagency referrals also happen, obviously, between CareDove accounts, which you're all familiar with. And again, receiving these referrals is fairly easy. Organizations can orchestrate this flow of the referrals that are coming in. They get themselves a toolkit from CareDove, and that allows to view details, communicate updates, and then tailor the appointments to exactly what is needed. And this digital ecosystem is built on thoughtful design. They have put a lot of work into using user-centric features, streamlining the path from need to the service, and then turning this complex care coordination ideally into just some simple clicks and some typing into some forms. On the organization end, you can see it here. These are all of the referrals that are happening, and you navigate to these referrals at the top of the menu, selecting the inbox tab. View all of your received referrals here. So you have a great visual representation of everything that's coming in. You can choose to open the referrals by a number of different ways, and these are available for use within the referral as well. So a lot of different options enable you to find the information that you're looking for. And as I mentioned, communication is both ways here. There are opportunities to continue any follow-up between agencies or between agency and referrer. As we saw with Sarah at the beginning of the presentation, we can track referrals and the workflow activities across teams through CareDove, and we can measure those outcomes for outgoing referrals to community services and engage fully with that broader network of care that is available in our region. Now, specifically with Ottawa Valley Health Connect, we can also keep track of visitors that are coming to Ottawa Valley Health Connect, and as well, we can record some quick feedback from those who want to share by simply clicking on that share feedback button that is on our homepage, and then completing a 2-question survey about how they found the experience of using Ottawa Valley Health Connect. So let's continue that feedback a little bit. I'd like to welcome back Samantha Kelly, who's a member of our Patient, Family, and Caregiver Network, as Joanne mentioned. Welcome, Samantha.
Thank you.
Lovely to have you here. Can you tell us a little bit about yourself?
Sure. So I grew up in Renfrew. I currently live in Horton Township. I did work as an ambulance dispatcher at the Renfrew Ambulance Communications Center for just over 8 years. I finished up there in 2021. And I'm currently finishing up a master's degree in health sciences where I'm studying inequities in rural access to health and care services in Canada. So that's kind of what got me here.
That is, yes, absolutely, and that seems very apropos for the this particular service that that we're offering now. And based on, let's start first with your experience in ambulance and fire dispatch in Renfrew. Have you seen or experienced issues as to how residents try and find home and community care services?
Yeah, for sure. Absolutely. There were always a significant number of repeat callers, and they were people who were unable to access home and community care services when they required them, or they just didn't realize that those services existed. We did obviously see a huge drop in that when the County Renfrew Paramedic Service ramped up their community paramedicine program, which was really great for those people. But there were always the callers who were trying to take care of everything themselves, either as caregiver or a patient, and they'd end up calling 911 out of desperation or because the situation that they were living with had become untenable. And yeah, so you definitely saw a gap in service connection there.
And when that happened, were you able to direct them in a certain way, or was it something where you two were left a bit flummoxed as on the other end of the line?
Well, off the record, because I don't work there anymore and whatever.
Yeah, sort of
But
put you on the
generally,
spot.
like when we received a 911 call for help, what we had to do at the time was send a paramedic service to help the people. I know that there are changes that have been in the works over the last couple of years. I don't really know how things work that way now, but at the time it was, yeah, 911 call, got paramedics.
So, considering your studies now in rural inequities with healthcare services, how do you think a website like Ottawa Valley Health Connect will be able to support some of those non-emergency, non-911 healthcare needs of the community?
Um, Honestly, I think one of the biggest problems that we face in rural communities when it comes to access to care services is that there's a lot of people in rural communities who just don't want to reach out formally to ask for assistance. Like self-sufficiency and reliance on their community over formal care are often really common in rural areas. And so it means that people might not ask for care until the situation gets really severe. So I think when we have resources like this that are available for people to access on their own without any involving anybody on the outside, it kind of empowers them to remain self-sufficient and maybe helps connect them to care a bit quicker and bridges some of that gap, that inequity that we see here.
I know that you've played around on it a little bit as well, as just to take a look. Is there anything in particular that you like about Ottawa Valley Health Connect?
I think it's really user friendly. So I do love maps, and I am a person that understands maps. It's kind of what I do in my studies. But I like how self-explanatory it is when people like get into the mapping and they select the type of care that they're looking for. Everything pops up and it kind of guides them and walks them through where they need to go. Yeah, I think it is very user friendly.
Wonderful. Samantha, is there anything I didn't ask that you'd like to add?
No, I think that kind of sums it up.
Wonderful. I appreciate it. I appreciate you sharing your thoughts with us, Samantha.
Yeah, no problem.
So that is our quick overview again of Ottawa Valley Health Connect. It is something that I encourage you to go to, and obviously you don't have to book a referral, but you can see some of the spots and go through some of the steps in order to see how user friendly it is. And just to give you another update, it is continually being revised. So we've had some great feedback from our communications committee, communications enabler group, and we will be making a few changes with regards to that in terms of messaging on the website, and we'll be following up with CareDev with a few address situations that we found as well. So we encourage you to go and give it a look, and if you too find anything that you think should be addressed or could be featured on our Ottawa Valley Health Connect, then please let us know, and we'd be happy to look at that in terms of features. And of course, happy as well to take any questions about Ottawa Valley Health Connect this morning. And I do see there are some in the chat, which I am going to try and access. And just feel free to jump in as well. So this says this does not, Peggy says to us, this does not include Indigenous services. So right off the beginning of Ottawa Valley Health Connect, these were directed to seniors care. And so in terms of specific Indigenous services, perhaps Jamie, you might be able to help out with regards to the outreach in order to bring more services perhaps into Ottawa Valley Health Connect in the future.
Yeah, absolutely. Thanks, Hans. What I would encourage is if there's interest from other sectors or other members of the Ottawa Valley Health team that would like to see additions to this or expansion, we are absolutely welcome to that. This is a bit of we started small and scoped on purpose to make sure that it was going to work and that we were engaging and we had the processes in place. And I think with the launch of this and some of the testing that we've done over the last few months, we're ready to expand. So Peggy, I'd be happy to follow up with you directly around looking at how do we expand this further and ensure that it's more inclusive to our full community. Does that work on your end, Peggy? I'll follow up.
Definitely. I was having a hard time to get on there. Definitely.
Thank you so much, Peggy, for that question. And Megan asks, how is the service meeting accessibility for those who do not have internet access or no email, whether by choice or inability to manage on their own? Is there opportunity to call and be walked through the process with an agent over the phone? And point blank, Megan, no, there is not. This again is a beginning steps of a navigation system, and we do not have the ability, as say with 211 at this point, to have a staff member that is available to be on the other end of a phone line at this point. So it is strictly web-based and internet-based. In terms of having an email, the emails aren't necessary. They are nice to have for clients who perhaps want to get that confirmation email, but they are also made aware of that email through the booking process, or excuse me, through of that referral through the booking process. And again, they fill out, if they don't have their email, they fill out all of their other contact information, and the provider will contact them if need be using that particular information. Does that answer your question, Megan?
It does. And so in response to that, in terms of your strategic plan looking down the road, has this question come up, and is there a course to address it or an opportunity maybe down the road to address it?
Maybe I'll jump in. Oh, sorry, Megan.
No, that's okay. Go ahead.
I'll jump in if that's okay, Hans. So we really see this as one of the tools for our navigation and support for referrals versus the tool. We recognize that particularly for our community, we're fully rural. Connection isn't always, an internet connection isn't always the best way. We are very phone-based for many of our community members. And so I guess what we're saying is that as we grow, this is one tool, but not the only tool. We will certainly not be putting everything into this basket, but looking at how to access. Within OHTs, we do have a mandate for navigation and supporting navigation, and we are working with Health 811 around that. Certainly all Ontario and our OHT can call Health or 811 and link in with Health 811 for some of those direct person interactions. And future state really will be that there'll be an integration between Health 811 and our local services. And so that is the vision going forward from the Ontario government for the OHTs to help support that, so that everyone is able to access these navigation and referral services the way that they need to or want to.
Great, thank you.
Yes, there will be, like with this, we've added another door, I think. So there are a number entry points for access now, as Jema mentioned, with 811 and then 211 as well. And eventually we would like to see that streamlining so that there is the consistency, and that's why we're building this particular website with that in mind, and employing CareDove in that regard because of its use across the region already. But yes, it's certainly something that we consider. And if we perhaps can't provide a particular service, there is another way that service is provided through Ontario Health or the ministry. Angie. Oh, we lost you, Angie. She may have disconnected instead of. Oh no, there you are. Hi, Angie.
I was about to start speaking, and then I realized I hadn't unmuted. So just a clarifier, and then something I wanted to mention. So it's essentially using the CareDove platform, right? So all the players that are on that right now. So I have been making referrals to CareDove for a number of years, and I love the service. I don't have any issue with it. But recently, I think it was 2 weeks ago, maybe, I reached out to one of the local seniors home support offices about volunteer visitor referral. And I knew there was somebody sort of different than I had previously referred to that was going to be taking on those referrals. So I emailed her first and said, I'm going to put this referral through CareDove if that suits you. And their response was, I don't really know who would even see it if you put a referral through CareDove at our agency. So if you don't mind, either email or call. So I just want to point that out, just because I don't know if I just want to make sure that if somebody's going to be putting in a referral for themselves, that it would actually be seen by the agency.
Yeah, thanks for that. Oh, I'll jump in again, Hans, if that's okay. Sorry, I'm always over talking with you. So yes, I think we continue to work. We have 14 organizations on the system right now, and we do recognize that some they all have a diverse size and volunteer base and staff base, and so we continue to work with our teams and to ensure that everyone's up to date, that we do have champions. Eganville Seniors is working on behalf of the initiative to do some quality assurance and quality checks to make sure that referrals are being picked up as we look at this change management, so that people are very secure in knowing that while we're going through this change, and there's some processes and some organizations might need additional time to ensure that their processes are caught up, that we do have some checks and balances in place to make sure that no referral that's being sent through the system is sitting and waiting. So does that help, Angie, or give you additional confidence?
Great. Yes, absolutely. Thank you.
And I would say it's one of those, a bit of a chicken and the egg sometimes, in that organizations don't necessarily want to change too many processes if they're not getting very many referrals. And so, but if they're not getting and so I would encourage as partners and service providers to start to send referrals through this system with that added trust that we know we have that safety net, which will help to drive the numbers up, and then people will start to change their systems and have greater buy-in in that way. So it's always that kind of mushy area that we're in right now as we look for improving our processes and adding another tool in that toolkit. But the 14 organizations that have been involved from the very get-go have been so supportive and willing to really look at how do we do things differently, how do we improve. They have very strong relationships and always been able to pick up the phone and call each other. But we're looking for how do we make efficiencies so that you can spend more time with patients and clients and less time on the phone with each other. And so this is one of those improvements that we're really hoping will drive that.
Thanks, Shima. Thanks, Angie. And Allison asks, are local libraries and senior centers, for example, being given in service on this navigation tool so that they can assist seniors who want to book services? And Allison's a great question. And we have not started our public promotion of this website broadly yet. And those are great ideas in order to be able to do that. So certainly those will be considered for our communications plan. And yes, we are looking at any way and every way to get the word out to help folks be aware of what's offered here. So thank you for that suggestion.
Okay, thank you.
And Jade asks, will there be opportunities to connect with 211 to ensure all local services available on this website are listed for local 211 navigators? Just broadly, I will say that the OHTs are involved with navigation committees at an OHT and Ontario Health East level. So there are many discussions that are happening with regards to patient navigation across our region, and then, you know, obviously across the province. But we have specific regionally focused navigation groups that meet regularly and are looking at these exact types of questions, Jade, in terms of making sure that 211 speaks to 811 and 811 speaks to 211, and now that Ottawa Valley Health Connect is in the mix, how we can play a role in helping our clients and organizations connect. Is that right, Jamo? Is anything else that you'd like to add to that?
Just that we learned that in next fiscal, 811 and 211 will have their information linked up and synced. So all the systems are coming together nicely.
Yes, and you know, I encourage you not only to go to our Ottawa Valley Health Connect to see what we have to offer in terms of home and community care services, but 811 as well. We're featured on there as a navigation tool, and there are continuous changes that are happening with that as well through the province. So we're constantly evaluating and updating as we see fit. Any other questions with regards to, well, to navigation in general or to Health Connect specifically? Wonderful. I'm just going to put up the the contact information. So please feel free to email us. Generally, you can email Jama, of course, and that's my email there, hcolburn@ovoht.ca. And then you can find us. You have to spell out Ottawa Valley Health Connect.ca in order to get to that website. And please let us know what your user experience is like, whether or not you're booking a referral or just want to give a little tour of it. We certainly appreciate everybody's time in doing so, and any feedback is greatly appreciated.
Seeing that there are no more questions, are there any last one more thing is in, thank you from Megan, awesome. And Matthew had to leave also and said his thank yous. Seeing that there are no more questions, I am going to thank all of you once again for the valuable contributions today, especially presenters Sarah, Hanson, and Samantha. Thank you so much. And for all the questions and the excellent discussion. Oh, and I see Brian's asking us to do a quick evaluation, and put the link is there in the chat. So please, if you can, go to the chat, follow that link. I don't know if that can be sent out afterwards in an email as well for anyone that might not be able to access the chat in this moment. I'm not sure. I'll leave that with you folks to figure out. Our next event will be February the 16th, and promises honestly to be equally engaging as we focus on child and youth mental health community plan. And this is a project, very important project, recently completed through the Phoenix Center. It will provide that overview. We will receive that overview on the plan for the next 3 years. They definitely did extensive consultation with youth, families, care providers, and service partners. That'll give us a chance to understand the plan and engage in discussions about implementation and collaborative opportunities. So once again, thank you to the staff for organizing this and getting the mini-series launched, to Jema and Hans and your team. And thank you all for being here with us today. And we really look forward to seeing you all again on the 16th. Is there anything else, Hans or Jema, that I should add to that, or is that?
Oh, that's wonderful. I will send out that survey, the quick evaluation through email if you're not able to complete it in the chat, because sometimes the chat doesn't always work, and we'll send that out and make sure that you get an opportunity.
Awesome. Thank you all so much. And we finished on time with a few minutes given back to your day. Yay! Good work, everybody.